I'll be taking up the dental module. Let me share my screen. I hope the screen is visible to all.
Yes, it's visible. You can proceed, please.
Thank you so much. So today we'll be discussing about the dental module in the Arcus Air. So these are the various agendas that we'll be taking care of today. First, we'll go with the introductions, then the workflows, which will be covered in the session, detailed demonstration covering each screen, requirements and the features, and the forms and charts. Then we can have a question answer session to clear all the queries. So this is our functional team. Dr. Kishore Kumar, he is a functional lead. Mr. Gokulnath, he's a senior business analyst. And myself, Dr. Shanu, I am a business analyst representing IQVIA here. So this is the workflow for today's demonstration, the OPD workflow, wherein we'll go through the patient registration, then chief complaint and HPI recording, then CPO screen, which is nothing but the order screen, wherein we can place the orders for the various investigations, lab and radiological investigations, and placing the pharmacy orders. Then we are having the recording the diagnosis, wherein we'll record the provisional and the final diagnosis. Then the dental chart screen, which is specific to recording the history and the treatment and the diagnosis and related to the various to the dentition itself. Then the treatment and the follow-up appointment. So this is the basic flow chart, which is showing the basic workflow in the Arcus Air, what we are having in the application. Then these are the three forms which we are having in the application: the dental treatment record, the timeout checklist for the dental extraction procedures, and the decaf form. Later we can have a question answer session. So now I would like to take you through the application itself. Here I have logged in as a registration desk executive and I have already registered the patient. Now once the patient is registered and their basic details have been recorded, the patient will be visible under the registered tab. In this screen you can see we are having these three tabs: registered, in progress, and the discharged. Now here from the registered tab, the patient will be taken up by the...
So, excuse me, I'm
Yes.
sorry, but can you speak a little bit fast?
Yes, sure. No problem.
Slower. Because actually, and also just we need brief introduction about the features here in the system. This is the left side and the upper side for branches here and
Sure.
rules. And, yeah, please,
Yes,
before
exactly.
going to...
Sure. Definitely. I thought I should not like make it even more confusing, messed up, or so that's why. Oh, anyways, I'll take up. So here I have taken up the role of a vital nurse. So once the patient is registered, the vital nurse, she will take up the patient. She will arrive the patient, and the status here will be changed as arrived in the department. You can see it here. Now the nurse, she will go to the observation chart. She will record the reason, put her credentials.
Hello.
Yes.
Dr. Shanu, actually you're going little fast, so if you can little slow down.
Okay, sure, please.
Dentists, we are not expert in the eye. Right. So we need the ABC first. Okay. So the icons which is around here, we should understand for what's that.
What is this icons? What is this?
Yeah.
Left bar, right bar, middle bar.
So also you can give a little introduction about the all the menus left side top what is
Okay, sure. So as you can see, this is once I have logged in as a vital nurse. So at the vital nurse, we have restricted permissions. The vital nurse, she can go through, she will have only permissions to this OPD work list, appointments, and the care provider schedule. And on here side, we are having the OPD EMR. This is the IPD EMR. This is the charting panel. This is the allergies, wherein the allergies are being recorded. We are having the alerts option.
Hello.
Yes.
Still it is getting faster actually.
Yeah, we cannot catch you. We are too fast now going through the screens and explaining this. Can you go?
Sure. Yes, I'll take you through. So, team, am I clear with this general vital sign? So here is the charting option, and when the vital nurse will take up the patient from the OPD work list under the register tab, she will access this chart. she will be landed up here in the general vital sign. Here she will record the vitals of the patient. This is the height of the patient, then weight, BMI and body surface area. This will be auto-calculated. Here she will record the temperature, the pulse rate, and for all these we have been given the normal range on this side. Once these vitals have been recorded, the nurse will save, and these vitals will be added up to the patient banner. So this was the role of vital nurse. Now the OPD nurse, she will access the patient from the in progress tab. Once the vital nurse has arrived the patient and registered the vitals, this patient will be visible under the in progress tab. OPD nurse, she will access the patient. She will, here we are having these 3 dots. She will click on these 3 dots. She will put here as arrived at the OPD clinic. She will change the status, and whatever will be the status, everything will be recorded over here. First the patient was registered, then arrived, and then arrived at the OPD clinic. Now once the nurse has arrived the patient in the OPD clinic, she will go to this icon. This is assign care provider icon. So nurse will click on this icon. She will search for the doctor in this particular department. What all doctors are there, we can get the list of all those doctors over here. Nurse will select the doctor as per the schedule, and she will save. Now once the care provider has been assigned to the patient, again the OPD nurse, she will access these 3 dots here, and she will put the status as screening completed. Once the screening has been completed, now I will log in as the doctor here, as a dentist. So every professional, whether a dentist or a nurse, they will be having their specific credentials through which they will access the patient. Now here the dentist, when he will log in with his credentials, doctor will be directed to this doctor work list screen. Nurse and vital nurse will be directed to the OPD work list. Doctor will be landed up directly here to the doctor work list. Under doctor work list, we are having these many widgets. So these are the outpatient widget, appointment screen, inpatient widget, consult or referrals, confirmations, lab results, deficiency records, radiology reports. So we can configure this as per the requirement. And suppose the patient, now the patient has been assigned a care provider, this doctor, dentist. So it will be visible under the outpatient widget. This was the patient. This is the status, screening completed. So for this patient, doctor will access the patient from here. Now this is showing that the triage is not recorded. So we are having a step here. The nurse, she will do the triaging for this patient. She will put whether this patient is urgent or less urgent, and accordingly she will do the triaging. Now the doctor, when he will access the EMR, it will show him, do you want to start the consultation? The dentist will click on yes, and then only the dentist will be allowed to access the EMR and record the details. Now the doctor, he will access the chief complaint. Here we are having this free text area wherein we can type free text. We are having this pass CC option. If there is any chief complaint that has been recorded earlier, we can pull it here. This is the search option. Here, as per the ICD 10 coding, we can search for the chief complaints. Suppose these are the list of the chief complaints. We can select, this is the chief complaint, and it will be added to the chief complaint section of the patient. Pain in the lower left quadrant, this I have typed as the free text, and this is what I have searched. Then we are having the present illness section. Here again we are having a free text option. Here we can add, or if we want to delete this, we can also edit it. Also, we are having this favorite note and a note template area where we can add as per these are the various segments which are available here. We can put some specific segments relevant to dentistry, and we can pull it here. Here I have created one favorite note, this dental pain. So I can click on this favorite note and it will be populated here. So patient complains of moderate to severe pain in the lower left back teeth region. Some past 3 days, pain aggravates on taking cold food or water. If I want to make any changes, I can add on it anything, or I want to delete it. I can add it also, or I want to delete it, I can delete it. And once I click on this option, it will get added to the patient EMR. Then we are having this past medical and surgical history. Again, if the patient is having any relevant medical history, he can click on this option. He can search. Suppose if the patient is diabetic, we can search all the various, the entire list related to diabetes. It will get auto-populated, and whatever is relevant, they can click on it and it will be added to the patient summary. Similarly, we are having this surgical history. Once we click on this, it will allow us to enter if the patient has undergone any history of past surgery. Suppose the patient has undergone appendectomy, so they can select it and it will be added. It will show us to this pop-up wherein we can add when the surgery was done, duration, years and months. They will be auto-calculated. If there isn't any relevant medical or surgical history, we can leave it and we can proceed with the family history. In the family history, we have configured this tick sheet. This includes the brother, father, mother and the sister. Suppose I want to add the medical history relevant to the father here. In the diagnosis section, I will write hypertension, and this will get added to the patient's history. Again, if the mother is having some relevant history, we can add it. Duration, years, duration in months, they can be added. Similarly, we are having the medication history. If the patient is on some medications, we can add it here. Else we can put it as not applicable or leave it blank. Then we are having the personal and social history. So in the personal and social history, again, this is the free text area. We can add here. This is what I have added in the free text. Other than this, I have got this tick sheet in which we are having various options like illicit abusive drugs. If the patient is having any drug abuse history, they can add it here. Smoking, if the patient is a smoker, we can add the duration for how long he has been smoking. Alcohol history, we can put it here or else we can leave it. So accordingly, the education level, language barrier, language spoken, current and past occupation, marital status, other tobacco uses, sleep, hyperlipidemia, long duration of diabetes. So these can be configured. There are all the options. Now I have added.
Hello.
Yes.
Yeah, Dr. Shani, we can skip this documentation part. We can go to the next stage.
Okay, sure.
Okay, thank you.
Sure. So I will directly reach here to the diagnosis. So here the primary diagnosis we will record. You can search here. Suppose the patient is having So right now, if I'm taking like disorder of the teeth and supporting structures unspecified, I'm taking it as a, let me take the disease of the pulp and the periapical tissues. So the confirmation is we are taking it as a provisional diagnosis, and the diagnosis type is the clinical decision. I will save it and it will be added here. Whatever is the primary diagnosis of the patient, that will be visible in the patient banner itself. And these are the vitals, they will also be displayed in the patient banner. Then once the provisional diagnosis has been given, now the doctor wants to order some of the lab investigations and the medications. So the doctor will click on this CPOE screen or the order screen. It will take the doctor to this screen. Here under the order item, we can search for, suppose I want to order a periapical view. So here is the periapical view. I'm putting this, and in addition to that, I want to order some antibiotic for the patient. So this is amoxicillin. So before placing the order for medicine, it will show us the pop-up that the allergy is mandatory to place the medicinal records. So I need to add the allergy details. So I have added that no known allergies for this patient. Now I will go to the order screen. I will place the order for again the periapical X-ray view. Then I will place the order for the medication. So once I have selected the drug for the medicines, it will show me this pop-up. The dosage and unit of measurement, it will get auto-populated. I just have to select the frequency, suppose BID. Not if needed, I will put it. After breakfast and dinner. Duration, I will put 3 days, and the quantity will be auto calculated here 6. So for this is for the diagnosis, disease of the pulp and periapical tissues. I will save this and it will be added to the patient's EMR. Now here I will put the credentials and save it. Once saved, it will be added to the patient EMR. I can expand this also, and this will show me what all I have recorded. So for the radiology order, I have ordered this periapical view, and in the medicine orders, it is showing the amoxicillin and amoxicillin clavulanate 625 mg medication for the patient. Now once the lab investigations are ordered, they will be directed towards the particular respective departments, the laboratory and the radiology. So once the results will be dispatched, they will be auto-populated under these two screens. This is the lab result view. So here what all the lab results will be, they will get auto-populated here, and the radiology results, they will be auto-populated under this screen. Now assuming that the lab results have been like dispatched for this patient and the apical abscess is the confirmatory diagnosis, so the doctor, he can again go to this diagnosis section, section, and he can search for the diagnosis here, periapical abscess without sinus, put it as a diagnostic decision, and in the confirmation he can put the final diagnosis and save it. Now once saved, it will be added as a secondary diagnosis here. After adding the diagnosis, doctor can click on the plan of care. In this plan of care, both the provisional and final diagnosis will be auto-populated. Now if I want to add a plan of care for the final diagnosis, I will click on this add plan of care. It will take me to this screen. Here we are having the goals option and the interventions. So for goals and interventions, we can either directly click here, add. I'll add a goal here. Put the status, started, and save it. It will be added here. Similarly, for the interventions, I can add either a description and save it. So this will be the goals and the interventions required that will be added to this patient. Now I will click on the update and this plan of care will be added here. We can add n number of goals and n number of interventions here in the plan of care. Now once we have added the plan of care and the diagnosis over here, the doctor will click on this dental chart screen. Here we are having the view of the 4 quadrants. Since this is an adult patient, so the quadrants here we are having the 1, 2, 3, 4. If this would have been a pediatric patient, this quadrant will automatically show us the 5, 6, 7, 8 quadrants. So for this patient, first it's showing me this history option. So if the patient is having any history relevant to any other tooth, we can select the tooth number here. Suppose if the patient has 2-8 surface, we can put the treatment as extraction. We can put the marking here of missing tooth and save. So this tooth, this marking will be saved here. So at a first glance, we can get to know that this tooth has been extracted, this tooth is missing here. And we can put the performed date also. Suppose the patient has undergone 1st December this date, we can put it here and we can put the care provider detail also. And if any remarks, we can put, the doctor can put it in this field. We can change the filter to all and we can add it here. So the history details, they will be displayed here. Similarly, then the diagnosis for the current, this is regarding the current tooth now. Now the patient is having pain in 3-6, we can select the tooth, then we can select the surface. Here for the diagnosis, we can select disorder of teeth and supporting structures. In the markings, we can select the periapical abscess, save and add. So it will be added here in the details, the history as well as record type, the history as well as the current diagnosis, they have been recorded. Now what all treatment we want to give? For again, for this tooth only, the surface, distal treatment. Suppose root canal treatment, root canal for the molar we are taking, planned on, suppose we want to plan it on 23rd, we can put statuses, it is planned, and care provider, we can put the care provider name here and add it. Okay, markings we have to select, periapical abscess and save it, then add it. So this is the planned treatment, root canal treatment for the molar tooth. This has been planned on 23rd December. Now this is regarding the dental chart. Once the patient doctor is done with this dental chart, he will click on this quick link option, on this plus option, and it will direct him to the forms tab. So we are having these forms related to the dentistry. So this is the dental treatment record. Here we are having, this is the pediatric chart for the pediatric patients, the quadrants, and below this is the adult patient chart for the recording the adult patients details. So here in this dental chart, now our tooth of concern is 3-6. So these are the various options through which we can mark the current condition of the tooth. We can change the width of the annotation which we are using. Suppose if the any tooth is restored, let me take 2-6. I can put it here. So this annotation means that 2-6 is restored. There is a restoration present in 2-6. Now if I want to put cross, so this 2-8 is missing. I can put this cross and it will show that this 2-8 is missing. Similarly, if I want to put a circle to notify that the current treatment is in reference to this 3-6, I can put it like this. Then this is the occlusal view. In the occlusal view, we can put similar annotations as I have mentioned here. Then this is the chief complaints. It will be auto pulled here and it will be updated in this form. ICD-10 coding, what we have added, we can update it. It will be added. Similarly, the medicine orders, whatever I have selected for the patient, we can update it. Then we can put the remarks, finalize this form. Once finalized, no modification can be done. Then this form will be added to the forms option in the patient EMR summary. This is the dental treatment record. Apart from this dental treatment record, we are having one more form. This is the timeout checklist for the dental extraction procedures, wherein the ICD-10 coding, the procedures, they will be recorded. So this is for the extraction to ensure that extraction has been done correctly or not. So correct patient, if this is we are planning for an extraction, then we have to fill this form. So whether this is a correct patient, nurse can fill correct procedure, correct site. Then site is marked in the dental chart, yes or no. Imaging data has been confirmed. Any special equipment which is needed is available. Does the patient need antibiotic prophylaxis? If yes, has it been given? So once this has been recorded, again, they will put the timeout here, signatures, they can finalize it and they can save it. And after finalizing, no modification can be made. However, if we put this into an in progress state, we can make the modifications from the patient EMR. Apart from this, we are having the sorry, I need to close this. The DCAF form, which is regarding the insurance. So this is the DCAF form to be completed and ID verified by the reception or nurse. So the provider name, insurance company, file name, TPA company name, everything that will get auto-populated. Apart from that, we are having this plan type, new visit follow-up, then insured name, ID card number, the gender and the age of the patient, again that will be auto-populated, policy holder, then policy number, this will be recorded here, expiry date of the policy, class, approval. Then this is the field which the dentist is supposed to fill. Suppose the duration of the illness days, if I put it like 15 days, chief complaint and main symptoms, like there is acute pain in with respect to 3-6, significant steps, we can put significant signs, we can put in here diagnosis, then primary, secondary diagnosis, other conditions, chief complaints, present illness, we can auto pull here. This is the chart. Again, we can use the annotations to make changes in this chart. Here is the option, do the image annotation. And if I want, I can make the changes here in the 3-6 option, selecting the relevant tool. Apart from this, we are having the these options, regular dental treatment, dental cleaning, trauma treatment, specify RTA, work-related other. So this is specifically for the insurance details, which is required. Dental service, tooth number, cost, which will be related to this treatment procedure, medicine orders. Then for the insurance company, they can get this filled. So again, it can be finalized and it can be saved. So once the sitting and the consultation of the patient is completed, the
hello.
Yes.
Hello.
Yes, Mr.
In the DK form, can we pull out the services which is already ordered? Services, ICD codes, those things?
Yes.
So whatever service I ordered and the tooth number, everything will be displayed in the DK form.
Yes.
I have to. Yes.
Dr. Shanu, let me take this question.
Please. Yes, please.
Yes, Prasad. Actually, what we will do is, she has shown the form. but ideally what we will do, we'll go to the pre-auth request screen and we'll pull all the orders in the pre-auth request as we shown you in the other section as well. Here itself we are having that form section where we will capture the decaf.
Okay, so you are saying if I'm fetching this decaf form from the pre-authorization screen, this
Yes.
Form will be auto-filled.
Yeah, actually doctor can fill there also. I mean, any one place doctor can fill it.
No, that's what I'm saying. Doctor already ordered the services, even ICD diagnosis, everything he has added. So
Okay.
why again in the form he will add that?
No. In form, you need not to fill again. It will auto-populate in the form.
Okay. I was asking that only.
You can see your chief complaints present illness ICD-10 where the doctor need not to type it. Just can click and update so that it will auto-populate there. See, you can see your pain in lower left quadrant and all. It is auto-populated. Can you click on it?
Actually, if we can avoid this step, we because again clicking 2 times, because anyway it has to fetch the whatever doctor ordered, right? They cannot modify anything here.
Correct.
No.
Patient goes for multiple departments, so the system doesn't know which diagnosis to select.
But decaf is one visit and it's a separate department. Decaf is only for dental.
Yes, I agree, Prasad.
Mr. Prasad, suppose here for the ICD-10 coding, we are having the provisional as well as the final diagnosis. So we just want the final diagnosis to be pulled. So this is giving us an opportunity to select only the final diagnosis and deselect the other options which are not relevant, which are not required here. So I'm selecting only the final diagnosis.
Yeah, for decaf, I think you have to show all diagnoses, not
only final. And multiple yes. Can also be there. No? नहीं बट हमको सिस्टम हिसाब से हमको फाइनल टेप प्रोविजनल दरकार नहीं ना हमको सब तो फाइन
finished. I have a couple of points.
Yeah. Okay, fine. We can proceed, Doc. So we'll discuss on this later.
Sure. So this was about the forms. This was about the forms. Now, once the consultation has ended, the doctor will add in his progress notes. This is the progress notes option. He can click on the progress notes and he can add the details. A root canal treatment with respect to 3.6. So or whatever, there's a free text area, so he can add whatever progress notes or as per his for his recording, he can put it here and he can save it. Once it is saved, this will again be viewed under the progress notes here. This is the progress notes by the care provider and this is the notes for him. So he can refer it whenever the patient will come for the second visit. Now, once this is done, the consultation is added. Now the doctor will click on the medical discharge. Again here, he will put the follow-up with the specialist. This task option will be enabled. He can put book follow-up appointment. Assigned department will be dentistry and he will save it. Once it is saved, the task will be generated for the OP nurse. So the nurse now here the task will be generated under the taskbar. So here this is the book follow-up appointment. The nurse will click on the appointment section. So this is the appointment. So after 3 days, she will select a time as per the doctor, care provider, and the department schedule. She will click on the section. This pop-up will show wherein the appointment date and time will be added. We can modify the time here. Suppose the first session might take some time, so we can put it 9:30. The care provider name, we can add it. Visit type, that will be a follow-up visit, and it can be status is booked. We can keep it confirmed. Once it is confirmed and saved, this print preview will be generated, and in addition to that, this schedule will show the patient appointment here on 25th Saturday. In this date, the patient's appointment has been booked. Next time when the patient will come, the patient will be accessed from the appointment tab. From the appointment tab, the patient will be accessed in the next follow-up visit. So this was all from my side. And once the patient has discharged, the patient will now be seen under the discharge tab. So this was all. Any further questions or clarifications team wants to ask?
Thank you. But actually, we have a lot of questions here. We will mention now by Dr. Khalid. But actually, as a hospital, we already have inpatient for dental as well.
Okay.
Yani for let's say for pedia, we have some let's say
surgery.
About OR surgery. They already have some surgery actually done as an inpatient. So
Okay.
it's already covered in system or no?
Sure. OR and IP flows that can be taken up in the IPD workflow and the OR sessions. But as per the requirement, we can configure it specifically for the dental.
No, you didn't get my point. Actually, this OR done by some dentist team. Okay. Yeah. For let's say for children, he have مثلا more than one teeth, one tooth. Actually, he wanted to fix it, and then they can admit the patient, the child, and then they go through everything once and one time with also anesthesia, with everything. So this actually orientation should be also announced to our dental team as well. Yes, extraction, or even extraction, some extraction, yes, cyst.
So the patient, when the patient is signed at the beginning, it has to be allocated to outpatient or inpatient.
Yes.
Each one has
ما
different
هو
process.
what they already have a doctor. Outpatient should become first. يعني you will see the patient before admission. You will check him.
Exactly.
Then you will request admission or request inpatient or OR for this patient.
Exactly.
Okay, and you have approval workflow for for approval insurance. After that, you will go proceed for OR. We have one room, number 2 OR room actually for dental, as you agreed here. So it will be assigned also only for dental team. Okay, so you can book it. The same, but يعني they already demonstrate this in OR section, but I need them to introduce actually to you.
And the patient will be admitted, and then it will be
Yes. So again, this cycle for dental inpatient, it should be covered also.
Okay.
As you know, we have 2 big hospitals here or 3 hospitals here. We have
Yes.
big sections for dental, big sections as well, and we have daily. We have one OR room actually is already booked full day, 24 hours for dental. So this is actually one of our biggest business here in our hospital.
Okay. Mr. Prasad, we can as per the requirements, we can fix it. Like we can configure it and have a complete workflow for the dental IP and admission or request what we are asking for. We can configure it. We have done it for other departments, and we can do it for dental also.
Mustafa, actually, we have that overflow, as you said. What is the basic difference will be is something, as you said, the OP patient will be referred to the admission, and it will go for the pre-auth, and after approval, the patient will get admitted. So the admission normal flow, as we saw all this IPD.
Yeah, we saw it with OR and the admission team. I know that, but actually we should present it also to dentists. That's my concern. We should demonstrate it to dentists as well, because actually we didn't invite them. in the OR session, our admission session. Anyhow, this first part. Second part, actually, Dr. Khalid Palto, he want to ask a lot of questions.
No, some questions.
Type.
By the way, we don't do triage.
We didn't do here. Yeah. First of all, yes. First of all, dental. You don't have triage for dental.
Sorry, dental.
Wait a second, but wait a second.
It's not mandatory, right?
vital signs يعني mandatory no for dental actually Dr. Khalid mentioned there is no need to have triage or vital signs for dental patients. Meanwhile, actually, sometimes we already requested for insurance as well. So it's the question is, it's already mandatory or no?
So you mean triage step should be removed? Triage
No, not. I mean it's already mandatory or no? Optional, yeah.
That is optional only. We can configure it.
Yeah, we can configure it. Okay.
Those in dental centers where we don't have hospital, we do have triage.
Nobody does triage.
We have, it's mandatory by MOH.
Not for dental.
We have it.
Okay, well,
anyhow, it's an option. It will be covered. It will be covered in as an option, and he mentioned configuration. يعني we can configure it as not mandatory. Okay, it's the second question. تفضل انت.
All right. So, hello guys. Regarding treatment plan, and you showed us that you can add steps. So patients who come to us, we usually offer them comprehensive treatment plan. I did not notice in your show that there is a status check on the elements of the treatment plan. For example, your treatment plan will consist of 10 steps: extraction, root canal, crowns, and so on. When each step of these is completed, there should be a status button through which I will know if this step has been done and done by who and when it was done.
So, doctor, we are having that dental chart. In that, let me share the screen. In that dental chart, I mentioned that the history treatment we are recording, and it will be added there. We are having the planned option. The doctor who is taking up the treatment, what is the current status, whether it is planned or it is completed, we can add it there itself.
Okay, so you're saying it's integrated. We have no problem in knowing the status, because the timetable that you show does not show the status of each treatment element. Will it show, like when I see it after a month, will it show that which of the steps in the treatment plan has been finished and which one are pending or in progress?
Can you go to the plan of care?
Yes.
Well, because she didn't show any status, right? Maybe she should have a status in progress. Yeah.
One thing, we are having this plan of care. So in the plan of care, we are having the goals and interventions. Sorry, I have discharged this. This is
revert the medical discharge on the top of the banner.
okay. So for this patient, we are having the goals and interventions here. Suppose we are planning the extraction, oral prophylaxis, root canal treatment, as you said. We can add it one by one here. We can put the status as in progress, met, not applicable anywhere, started.
Good.
This we can update. And in addition, and doctor, in addition to this, even in this dental chart, here we can add. Suppose the patient we had planned a root canal treatment for this patient. So this is still planned.
Can I ask a question here? The description column, no, the description column. Can you see the? Can you please widen this so it can be read easily, because as a column like that, it looks interrupted. So can you widen the column for the notes?
Yes,
Well, doctor, that's
we'll
a alignment issue. We can figure it. We can fix it.
Okay.
And
Good.
here in this
So can
screen
I-
also we are having the progress notes.
No, you answered my question. Great. So can I go to the next step?
Yes, sure, please.
The drop menus that you showed, whether it's medical history, treatment options, so on. If there is no item in the drop menu, can we add like medical history, people who have myasthenia gravis or something that is not in your list, or a treatment plan that needs treatment option dentally that is not in the list? Can we add item to these drop lists?
This is the free text area. We can add it here, or we need to enable this permission of the tick list, tick sheet we are having. We have, this is the tick sheet. We can add if there is anything specific.
She did not answer my question. Can I add to her drop list? Can I add things that are not there?
Yes.
Okay,
Doctor, you are asking about this tick sheet. We can add it.
Okay, let's say in the medical history, a patient came with a rare disease that is not on your list. Can I add it to the database?
Yes, we can enable this option, free text area, and we can add it.
And we can add. So
Yes.
we can edit the master list.
From the admin, basically, not from you.
I have to go to the admin.
Yeah.
But we have this feature.
Yeah.
Okay, باشمهندس محي معنا. We can add to these lists. مش هتقول ما هنغير.
We can add the group list. We can add.
No, edit يعني add.
Or if you want to add the list itself, you can add.
But through you guys.
Yeah.
Through you. Okay. Right, great. Okay, we come to another point, which is the radiology. You know, we have several types of radiology images.
Yes.
One, you talked about one of them, which is the periapical, but we have also bite wings, we have panoramics, and we have CBCT, which is computer-based tomography.
Yes.
We want to know how all of these softwares, or will these softwares will be integrated to this platform.
Yes.
In other words, to see the CBCT, I don't have to open the software for the CBCT. It will appear here. Is that correct?
Yes, we have the images option, and we can have the images that will be listed under the diagnostics list. We can attach the image and it will be visible in the EMR itself.
Okay, the reason why I'm asking, because at the moment, we have a big problem in the integration of the softwares for the CBCT, panoramics, and PAs with the current platform that we're using. So I want to make sure that you guys are aware that integration could be a problem.
Yes, still, Jagdish, I hope we can add.
Actually, we have two options. Like as Dr. Shano said, this diagnostics where she is referring to in the screen, directly in the HIS itself, if we report, it will we can able to see it, or you can see in the banner next to referral, you can see PACS link. If in case the integration is there, if the scope of that particular machines which you are referring is integrated with the HIS, then all these studies will be, all the results, images and reports which is done in the machine side will be integrated by just clicking on that link. We can able to see it. Right now the integration is not there, so maybe we will establish that link. Two options is there.
Okay,
Either
so your answer, sir, that it's not linked. You're going to establish the link? Is that
yeah,
answer?
we need to check whether the machines which you are referring is there in the scope or not for integration.
Because
That
we have 3 softwares, right, Mr. Mustafa? Mr. Mustafa? We have the software for the CBCT, the Romaxis, and the other one. What's the other one, yeah, Karen? For the CBCT?
And the other one,
Huh?
The software for radiology, dental radiology.
And NNT.
Oh, NT.
And the other one for the CBCT. What's the name?
The clinic. No. That
We have
NNT? NNT, right, NNT.
different clinics for radiology, for dental.
Yeah, but the X-rays are taken whether from the X-ray from the clinics or from the radiology department. So the input is variant.
Yes.
So, but we send the patient with the number, with his number, so they can open his screen. So the radiology unit can be dealt with as a dental chair.
Should be integrated. But just to confirm with Mohammed Al-Tayyib, and provide
Those lists are not
this models. Even we have some sensors also.
Those lists are not given.
No, this is to the softwares.
Sorry.
Those lists for dental X-rays and radiologists are not given.
Why?
Your users.
Sorry.
No, why? No, they are not given to us. So how will we know?
Okay, this is from Mohammed Al-Tayyib, Habibi. Okay, I told him from Mohammed Al-Tayyib he should give it to him. Anyhow, we will deal with this. We will send you, for integration part, we will discuss it. No issue.
Yeah. Just want to know that if this dental platform is connected to the medical, because according to Sibahi, we have to be able to access the patient's, blood analysis and stuff like that. We can. All right. Last point here, ladies. طبعا Mr. Mustafa told you about the outpatients and inpatient issues that got to be incorporated as well.
Yeah.
Last point is the forms. We have forms that patients have to sign, among which is the consent forms for surgeries and non-surgeries. Also, the medical history must be signed, because if the patient does not tell me about the condition she or he has and signed, and then there's a problem happens, I will not be held accountable. What is your process for digitizing these forms?
To have gaps.
No, what he mean actually, we want, we already have some additional forms that already should be signed by patient himself before treatment, before go for procedure as well. So this form is actually, doctor, I will request you to provide us with this form.
We have all.
Okay, hard copy, give it to us, and then we will provide them.
Okay, but and the patient will sign it digitally or organically?
ده system web-based اشتغل على tablets.
Tablet. Okay, it's
one
on the
tablet
system.
for
It's on the
reception.
system.
Yeah.
Wonderful.
Electronics. Provide us with the.
Already covered that's all from our side. We are waiting for
Will we be able to generate reports here?
Yeah, well, can you doctor asking here about some reports, because actually he's from top management and he wants some reports related to, let's say, doctor performance and so on, something like that.
Actually, ideally, gentlemen, ladies, we need reports per service number. All of these services that you presented, the drop menus, of course, have number. We need reports by doctor number, employees number, which we have the database for that. We need a report per clinic, and we need an integration of a report per income also.
The income, it will be in
The back office, but here is for the per services, per doctor, per outpatients, inpatients, all these details.
Yes, it will be from here.
Because he did not talk about it, so it's there.
No, we can. Can you give us one brief about reporting related to doctor statistics and doctor performance from here?
Mustafa, actually, reports we have not configured. As we said in the report section, it will be like we will get the reports format from you and we will deliver it. Because we have multiple report formats, because we cannot pull all the statistics.
Sample of reports.
Yes.
اديني sample of reports بس sample of required reports and then we will provide them. They will build it on system and you can easily لا يعني whatever Excel sheet او فورمات عندك فورمات معين برنت حتى سكرين مثلا باين فيها some reports. Then we will provide them and then they can start to develop it on system as well and you can easily extract this data from it.
So you need to get the reports
and form, yeah, please. And again, the final step is integration. Inpatient cycle. It's the remaining inpatient cycle for dental.
Okay. Inpatient cycle. We can club it with this also. Cath lab also is related to OR functionalities. All OR functionalities will be in cath lab. If you can.
I will discuss it with Ala. Actually, it should be separate because dental team here is, as I mentioned, different business units here inside the hospital, and we have nine dental centers overall the kingdom. So it's totally different business. We can't invite them in cath lab sessions as well. Anyhow, we will discuss with Ala, but yeah, just consider it as a point, okay?
Okay, fine.
Okay,
thank you.
Thank you.
I will after the meeting to discuss the same.
علاء صوتك بيقطع والله. علاء صوتك انت بيقطع، انا سامعك. I can't hear
I will call you by phone. I will call you by phone.
انت شكلك مش واكل كويس. او واكل فول بقى، حاجه من الاثنين.
واحد من الاثنين.
اوكي خلاص. call me back. Okay, ان شاء الله. Thank you.
Okay.
Thank you.
Thanks,
Appreciate. Thank you all. Thank you team.
Very much. Thank you.
Thank you. يلا باي باي.
Thank you, doctors. Thank you so much, team.